We've all had some aches and pains at times, especially as we get older. And when is it time to seek care? This afternoon, we have Dr. Zubair Ahammad with us, a neurosurgeon for Mercy Health, to talk about some of the things we should keep in mind. Doctor, welcome. Thank you for coming in.
Thank you for having me.
How prevalent is back pain? I would guess everybody has it a time or two.
It is actually one of the most common complaints in the primary care office, which means that there is a significant number of people that present to their family doctor with back pain as their main issue.
I know years ago I was in treatment for some back pain, and all it was I needed to work more on my core. And the physical therapist had me working on sit-ups and trying to strengthen my stomach because it was causing a strain in the back. There's so many different things that can go on. What's the evaluation process? How do you figure out exactly what the problem might be?
So typically when we see someone with back pain, first off, as a surgeon, these patients are kind of trickling down to the point of seeing us. They've oftentimes seen other providers and other physicians. And so when they get to our point, our goal really is to kind of go through the check boxes. And those check boxes really, the biggest thing we want to do is not miss the bad things. What we call in medicine are red flags. So red flags are things that are dangerous. And so we want to make sure things, for example, like that 1 in a million cancer patient that, presents with back pain, or a bad infection, or someone that has really scary neurological complaints like losing controls of their bowel or bladder or paralysis. That's a very small percentage of people. And so first job is, make sure they're not in that pool of patients. Beyond that, it's really kind of a broad, slow workup, and it involves really hitting it from all sides. So I tell patients all the time, treating back pain is like treating diabetes. You never really hear of anyone getting put on a pill and then they're cured. It's really a lifestyle modification. We hit it from all directions. So we think of diet, we think of weight loss, and in the same way with back pain, it's a number of things. And so that could include, just like the things you talked about, strengthening your core, which includes your abdominal muscles, your lumbar core, weight loss. As we know, obesity is an epidemic right now, and that's a significant contributing factor. But there's a lot of other elements that go into it as well. A lot of times we spend time understanding what are the patient's burdens on a daily basis. What type of work do they do? What type of work did they do and maybe they're retired from? What are their other orthopedic injuries? Do they have bad hips or bad knees? Sometimes it's as simple as they have really bad shoes and they need insoles. So it really is a 360 type of approach.
Well, I know a lot of repetition can wear down a body too. For example, golfers, typically some pro golfers have historically bad backs. Fred Couples has always dealt with that his entire career because the repetition, if you don't do it correctly, it's going to cause an aggravation, inflammation of sorts.
Absolutely, absolutely. And every job has its own hazards.
Sure.
And we see patients that are electricians and plumbers and athletes, really physical type of careers. But turn to the other end of the spectrum, for example. If you have patients that are desk workers and you say, oh, well, that's a pretty sedentary job, you're not really beating up your back. Everything has its risks. So if I were to take that element of the population, I have simple questions, for example, like, do they have a standing desk? Are their feet flat when they're sitting? Do they give themselves breaks? Do they have good lumbar support?
And if you're in a chair, are you slouching? Are you sitting with proper form there? Because if you slouch, that puts pressure on your lower back, and that comes back to bite you.
Absolutely, absolutely. So, there's a whole spectrum. We've got your desk workers, you've got physical, labor-intensive type of careers. You've got people like truck drivers, that are on the long haul and sitting for long periods of time, and there's only so much you can do. So that's probably one of the more challenging elements, is understanding the individual patient's lifestyle, their career path. What are the elements that are contributing to their back pain?
If you're doing yard work, you lift something heavy and your back starts hurting, it might be a muscle. You might have popped what do you call it in the back?
The disc.
The disc.
Yeah, no problem.
Pop the disc, yeah. All kinds of possibilities.
Yeah, all kinds of possibilities. And I think that's one of the challenges, I think, with back pain is that, one of the things that we have to do in medicine is that we have really what I call a game of translation. And so we're taking, someone's layman's term, someone that's not medical, they have a problem, they're just coming to see a doctor, and we have to translate that into an actual medical problem. We have to define it. And so one of the most complicated examples of that is back pain, because back pain technically could be coming from any number of sources. So there are the joints in your spine, there is your hip, there's what we call the sacroiliac joint, where the spine connects to the pelvis. There are innumerable muscles and fascia. There are strains, sprains, fractures, disc herniations, all basically an alphabet soup of medical terms that we have to translate hey, my back hurts, into. And so that really is kind of the black box that we work with when we first see a patient.
And so when they have a bad back, they call you.
Absolutely.
Doctor, thank you so much for coming in.
My pleasure.
Hope you have a good back. I'm holding up okay.
So far.
For the time being, yeah.